Somebody said, time and money wait for no man. So we can start. My name is Kireki, Omanwa. And you can see that here. And today we are going to talk about infertility. I was asked to talk about infertility and lifestyle, but I'll give a broad overview of what infertility is, what some of the problems, some of the causes of infertility. Maybe before that, I'll present to you definition of infertility, maybe a broad overview of the problem of infertility, and some of the causes of infertility, how we diagnose it, and the treatments which are available, as well as the myths, because there are many myths which are present, and most of those myths are just myths, and we shouldn't actually even consider them. I teach at the University of Nairobi, Department of Obstetrics and Gynecology, and I'm a fertility specialist. I wonder how many of you were alive in 1978? Tafadhali mikono juu. How many of us were alive in 1978? Okay, not very many of us. Three things, very significant things happened in 1978. For those ones of us who are Kenyans, I don't know whether we know that face of the late, the first president of this country, Mzee Jomo Kenyatta. Died in 1978, 22nd of August, all right? And then something else happened, had actually happened a little bit earlier than that, and that other Mzee there, Mzungu Mzee, we don't call them Mwazees, do we? That was, if we remember, anybody remembers the name of that Mzee? Oh my goodness, we don't follow history, yes. Yes. No. The second. That's John Paul II. John Paul II was one of those popes who was non-Italian. I mean, there had been non-Italians before, but for a very long time, there were non-Italian popes until he was elected again in 1978. Okay? And do you know his name, his real name? Because usually when popes take their name, they become popes, they take an official name. Anybody remembers his name? Yes.
Joseph Ratzinger.
Joseph Ratzinger. No, Ratzinger he's actually still alive. He's a Pope Emeritus. Yes.
I remember only one name.
Which one?
Tyler.
Okay, White Tyler. Okay, almost here. He was actually called Karol Wojtyła from a place called Kraków in Poland. Okay? And then something else happened again in 1978. We got the first test tube baby. Alright? Louis Brown, who was born in, I think it was 17th of July, 17th or 25th of 15th or 25th of July, 1978. You can see that was a newspaper. I think it was the Daily Mail. Meet Louis, the world's first test tube baby, arrival super babe in Oldham in the UK. This news was met with a lot of controversy. By the way, if you have any questions, please put them down and we'll deal with them at the end of this discussion. The birth of this baby made a lot of, it was very interesting, and of course everywhere, as in anything that is new, not only in the medical world, it made headlines, and it was a turning point in human reproduction. And then apart from that, it gave a lot of hope to millions and millions of couples who had issues with reproduction, issues with infertility. But in as much as something new creates a lot of headlines, it also creates a lot of controversy. There was a lot of pushback from the Catholic Church, and not only, but from other centers as well. Religious leaders, just like in the first time we had the first heart transplant, people said, how can you touch the heart? Because as the Bible says, out of the abundance of the heart, the mouth speaks. So here, the church said, you have gone now into the bedroom, you are going to do things which we are not supposed to do. You are actually now behaving like God. You are actually going to create people. And this is not right. What type of children? You are bringing up children. How are these children going to look like? Are they going to be monsters? Are they going to be normal children? And what is this? Artificial intervention is not allowed. Even now, the Catholic Church does not approve of assisted reproduction technologies. Here we have the picture of Louis Brown 40 years later. You saw the first picture in 1978. This one is about 40 years later. And 40 years later, you can see IVF, 6 million. Now it's about 7 million, or slightly over 7 million babies later. So this issue or this method of helping couples who have had issues with infertility has actually gone a very long way in helping couples actually have families. But then something else which I want to bring across is that infertility is not a new problem. It has been there from a very long time. And I usually like quoting this verse. And God blessed them, and what did he tell them to do? No, he didn't tell them. God told them to go and have sex. Simple. We don't say that in church, do we? But how do we create children? By pollination? Simple. You guys have to have sex in order to have children. So God told them, go and have sex so that you have children. We are talking about this in church because it is the right place to talk about it. Because there is no way you can multiply. Yes, too. These days you can multiply without actually having sex. But in the beginning he told them, go and have sex so that you can have children. And it is written in the Bible that Adam knew his wife. He knew his wife, and his wife he bore a son. So there we go. Be fruitful and multiply and replenish the earth. Okay? Now, are there issues of infertility in the Bible? Yes, right from the beginning. We know Sarai, Abraham's wife, had a problem. Remember, she was told she was going to bear a son, and then when the time said, I'm a 90-year-old woman, how am I going to bear a child? It is not possible. So what did she tell Abraham? Just like our ladies, isn't that what happened? Isn't that what happened? So that Ishmael was born, but it was Mpangwa Kando. That was not God's plan. But then later on, she gets pregnant and she delivers Isaac. We know that. Rebecca, Isaac's wife, was also had a problem with infertility. Actually, if you read that text a little bit earlier, it took Rebecca 40 years before she actually delivered. So, 20 years, sorry. Because by the time they start pleading on behalf of his wife, it says Isaac was, I think, 40 years. And by the time Rebecca delivers later on, it says he's 60 years. So 20 years of doing what? Begging. Please, Lord, help me have these children. Rachel, Jacob's wife, we remember. Jacob, we know the story of Jacob. Jacob went and did what he did. And on the day of the wedding, he's given somebody else. Akasema ni sawa tu. Itaendelea na haya mambo. And then later on, he gets the love of his life, who is Rachel. But lo and behold, Rachel does not bear children as he had expected. And Rachel is actually keeps on nagging Jacob, saying, give me a child, give me children. And until Jacob was desperate. Because in the Bible it says, Jacob asks, am I God that to give me a child? But we know that later on she bears 2 sons, and she actually dies in childbirth. And we think that she actually died because of what we call PPH, postpartum hemorrhage, which is one of the biggest problems that is killing our ladies today. It's actually the top 4. PPH is one of them. Hannah, Elkanah's wife, remember? The mother of Samuel. Remember when she was in the temple praying until Eli, the high priest, thinks that she's drunk? He says, how can you be drunk so early in the morning? He says, no, my Lord, I'm not drunk. If you only knew the problems that I'm carrying in my heart. Her co-wife, Penina, was actually making fun of her. I can imagine, ladies, one of the worst things that you do to your other ladies, and if you really want to hit your lady friends, you hit them where it pains most, and that is children. Enda uzai mtoto wako, wacha kuwatafadhamu mtoto wako. Enda uzai. I think that was Penina telling Hannah, enda uzai, wacha kung'ang'ana na watoto wa watu wengine. So there it goes. The Shunammite woman also had a problem with infertility. So it is an old problem. There have been many ways of trying to solve this problem. But here we are in 2022. We have ways of solving it, but it has brought other problems as well. We'll talk about that in a minute. Now, Proverbs talks about things which are unsatiable, things which cannot be satisfied. They say there are 3 things that are there are things that are satisfied, but 4 things say not it is enough. The grave, people are dying, people have been dying, people are dying today, and they'll continue dying. The barren womb. If there is a problem that, if there is an issue which affects women so much, is the issue of infertility. And a womb that has not delivered. I see patients who come and say, let me get pregnant and lose the pregnancy. So at least people will know that I also can get pregnant. But not to get pregnant is actually a tragedy for women. There's a patient who came to see me. She was about 50 something. And when I started talking with her, she told me, Daktari, I've been, that was her 5th marriage, I think. The first one ended after 3 years because of violence and whatever. She left it because she couldn't have a baby. She went to the second one, stayed for 6 years, ended because she couldn't have a baby. Went to the third one, ended after 4 years, again violence because she couldn't have a baby. She went to the 4th one, 6 years, ended because again of violence because she couldn't have a baby. So she was in the last marriage now, this the 5th one. Said, Daktari, I must have a baby. I don't know what to do, but I must have a baby. Another one came and told me she had tried to kill herself 3 times, attempted suicide 3 times because she couldn't have a baby, and the people were making fun of her. You can't have a baby, so you are actually not a full woman, as it were. So which actually is depicted in this verse, that one of the things that is very difficult to satisfy is a womb that is barren. When you talk about infertility, there are different types of infertility, mainly primary and secondary infertility. When you talk about primary infertility, this is basically a couple. Here I have to underline a couple which is heterosexual. Because you can't be gay and say you have primary infertility. But we will not talk about that because these things don't happen in the Seventh-day Adventist Church, do they? No, they don't. They're just out there. Wombo, but we will not talk about that. So when you talk about primary infertility, it's basically a man and a woman who are in a relationship and they have been having regular sex, and regular sex here is 2 to 3 times a week, and 1 year has passed and there is no pregnancy. So sex 2 to 3 times a week, 1 year has passed, no pregnancy. That is primary infertility. Secondary infertility, they have a child, or they have had a child or children in the past, or have had a pregnancy in the past, and they are trying to get another pregnancy. And again, the same timeline applies. That is, 1 year has passed, 2 to 3 times sex in a week, and no pregnancy. There is a caveat to this as well, that the woman is not breastfeeding, because when a woman is breastfeeding, there is a mechanism that usually stops her from getting pregnant. And here the intercourse, I must say, is unprotected. So hakuna mambo ya CD, all right? And there is no pregnancy. When you look at the extent of infertility, a big problem, even though we don't talk about it. In the so-called developed world, it affects about 8 to 10%, which is not a huge number, but let's put that in the parking lot, as it were. According to World Health Organization, it is the 5th highest serious global disability. 5th highest global disability. So when we go to shopping supermarkets, there is a special parking place for disabilities. Do we or do we don't say it? Handicapped, there is a place there. You can't park there, because if you park there, it's actually it's an offense. Now, if it is the 5th highest serious global disability, so around supermarkets, they should actually put a lot of places for people who have issues with infertility. I wonder how that they would mark them. Maybe they would mark a sperm with a walking stick, maybe, which is standing there. So don't park there, because these are for people who have what? Who have issues with infertility. But obviously, we don't want to tell anybody that I'm having a problem with infertility. So it is a stigma, it is a quiet problem. We suffer quietly, we don't talk about it. Even amongst families, we don't talk about it. It is, in the Italian, they call it ometta. Don't talk about anything, all right? Now, what about in Kenya? Because you said in developed countries, it's about 8 to 10%. In Kenya, it's about 15 to 20%. Some researchers say it's actually more, even up to 30% in other African countries. Paradoxical. Why? Because in Kenya today, the birth rate is about, every woman bears about 4 children, 4 or 5 children. It has come down from the 70s and the 80s, where it was 7, 8 children. In Europe, the numbers are worse. In Europe, in some places it's 1.25 children per woman. In Asia, 2 children, 2.2. The numbers are quite low. Then how is it that in these countries where we have a reasonably high fertility rate, 4 children, 5 children, we have the highest infertility rates as well? 20% is a lot. Look at it this way. If we work with a population of about 50 million Kenyans, and then let's say that about half of that are actually adults, so 25 million. So if we say 20% of 25 million, 10% of 25 million is 2.5 million. So 20% will be about 5 million, right? Nairobi has a population of how many people? 5 million, 3 million? About 5.6 million. So let's work with that. So it would mean that anybody or everybody who lives in Nairobi actually has a problem with infertility. Can you imagine that? We should actually be shouting, making noise. He said, we have a tragedy in our hands and nobody is talking about it. 5 million Kenyans are crying in their bedrooms, are having, issues, violence, their divorces, because of what? Inability to have a baby, or babies for that matter. It is a social problem. Ladies, as you know, you are identified by the child that you have born. Men obviously become later on, but they tell you, go to Mama so and so, enda uongee na Mama Lydia. Mama John. Endo nilete kibiriti kutoka kwa Mama John. So what happens if you can't bear that mom? You can't bear that little John, or that little Lydia, or that little Maria, or whoever it is. So you basically don't have an identity. Whether we like it or not, this is the way society works, and there is no way we can run away from it. All right? There have been instances whereby, even in this church, even in the Adventist church, elders who unfortunately have an issue with this, when it comes to church board meetings, and the head elder, and people know that the head elder has a problem, when he stands up to speak, people disregard what he says. Why? Simply because he doesn't have a child. Even in your own settings, when you go home to family meetings, you who has a child or have children, they listen to you better than to your brothers or to your family members who don't have children. And they consider those who don't have children boys. Huyu ni kijana, hajazaa. What can he tell us? Hajui mambo ya familia. Sindio? Unfortunately, that is a big problem. I had a patient of mine who told me that every time they went for family gatherings, and she's in the kitchen cooking, in the sitting room, her aunties would say, watu wengine walikuja tu hapa kukula tu chakula. Watu wengine hatu wanakuja hapa hata hakuna kitu wanafanya. And one of my friends from church, actually one day, this happened in church. It's not something that I was told. She had gone through a miscarriage. She had lost a baby a few weeks before. And then she meets her friend in church. And this friend starts asking her, utaanza kutapika lini? Utaanza kutapika lini tujue kwamba una mimba? But she didn't know that the person she's asking, utaanza kutapika lini, had actually gone through a miscarriage 2 weeks before. Very, very cruel, very crass. Another one came and starts poking another lady's abdomen. Utapata mimba lini? That was in church. No, it doesn't happen in this church. It happens in other churches. See? But it happens in your church, I know. It is a medical problem. How is it a medical problem? If your sperms are not swimming the way they are supposed to swim, to get to where they are supposed to swim, it is a medical problem. If you don't have sperm, gentlemen, it is a medical problem. If your sperms are not the number that is required to be able to serve, to fertilize an egg and create a baby, it is a medical problem. It is a medical problem, ladies, when your tubes are blocked. It is a medical problem when age is a factor, when the number of eggs is low and the quality is not. It is a medical problem. We will come to that. It is a cultural problem. And this one gets even a little bit more complicated because, and this is not a Kenyan problem or an African problem, we prefer children of a certain gender over another gender. Ukweli uongo. Lakini kanisani tunasema watoto wote ni sawa. Si ndio? I've had people who come to me, they say, daktari, me I have 4 girls. Sasa, I'm an African. What am I going to do? Serious politicians come and say, I have 6 girls. Even now, they keep on bringing young girls to me. Ebu jaribu na huyu pengine. Maybe you can get a baby boy, so that we know now that you are a leader. So you're not a leader if you don't have what? You don't have a boy. And these boys, when they get married, wanakusahau. So it is a cultural problem. There are issues of inheritance and so on and so forth. All right. So I'll dive, quickly into some of the possible problems, some of the possible causes of infertility. I'll start with the men. I usually start with the women, but let me start with the men today. So anyway, ladies, I'll deal with you in a few minutes. Now, they are not in any particular order of importance. Chronic diseases. As we grow older, gentlemen, we have diabetes, we have hypertension. Some of the medications that we take are going to affect our bedroom issues, all right? And the diabetes over a long period of time is going to affect the nerves that actually cause you to have an erection, and this is going to be a problem. Lifestyle. In church here, we don't talk about smoking because we don't smoke. We don't talk about excessive alcohol intake because as Adventists, we don't ascribe to that. But high BMI is an issue, can be an issue. In most societies, once you get married, gentlemen, we want a public opinion. Something to go in front. So that's when they know, our son got married well. The wife is taking good care of him. And on the opposite side is that the ladies, once you get married, Africans generally, we like our ladies who are well endowed. The right places. Now imagine you are well endowed as a lady. Now say a public opinion. Mzee can't get where he's supposed to get. Anajaribu lakini is too far away. So how are you going to get pregnant? It becomes a problem. So high BMI, excess weight, can be a reason for infertility. Use of drugs here, we don't talk about it, but it is a creeping problem. It is coming into church as well. Young people. We are not very many young people here, but I believe we don't do it here. Stress. When you talk about stress, when you have stress at work, when you have stress at home, etc., that is going to affect us in our fertility issues, especially men. Men, we don't work well under stress when it comes to some things. I had a case whereby this couple had gone through an IVF cycle. In an IVF cycle, we treat them, we give the ladies injections, and when they're ready, we collect the eggs. All right? And then the gentleman has to give a sample. And you are told, here, there's a container here, go there, utoe mambo yako. And you know how it is in a clinic? The room is somewhere there. You can hear people walking around, out. So for men, that is a problem. So this particular couple, the gentleman tried kutoa. And actually it is done through masturbation. Leo tunaongea tu mambo wazi, si ndio? Yeah. It's actually done through masturbation. So the guy tried huko ikakataa. Akajaribu, he was in that room for about an hour, nothing. So you try, pressure, watu wanapita, mama nangojea huko, the eggs are waiting to be fertilized. Will I be able to produce this thing? It's not coming out. Akatoka akasema, it's not. And then the ladies are actually, the ladies, and the guy comes, the reception area, and there are people, that place there, the other patients seated. And the guy comes and whispers to the lady, and then he looks down. And the lady was like, what kind of man are you? Wewe kazi yako ni kutafuta utamu peke yake. Hata kutoa huwezi kutoa. And the man just went like a flower, completely deflated. Stress. He could not get up to the standard when it was needed. So stress is horrible. Stress can actually, even for ladies, the only thing is that we don't know to quantify how much stress can actually lead to infertility. We see this when couples have tried to have a baby, it has refused. They actually even go and adopt a baby. Once they've adopted a baby, that pressure from society and so on is sort of relieved, as it were. And then all of a sudden they come, they say, Allah, I missed my periods. I thought it was just one of those things, but I checked, I'm pregnant. Right? So stress is a problem. Infectious diseases. For men, I don't know how many men know about mumps. Do you know mumps? Ever heard of mumps? Yeah. You don't know. A big problem if we get this disease in old age, when we are mature, not in old age. 18 and above, it becomes a problem. It is okay when you are younger. And we used to make fun of each other. Ona umefura. That one was protective. It's actually protective for us. But when you get it when you're older, in a trauma fuse. Okay? That is mumps, orchitis, or viral orchitis. Orchitis is basically infection of the testicles. Blocked tubes. Blocked tubes is a big problem, even in this country. We are actually doing some research, we are collecting data to see the extent of male infertility. And one of the problems that we are seeing are these gentlemen who come and they don't have any sperm. And they're firing. So that is one of the myths which we'll talk about later on. Meaning that in order for the sperms are produced elsewhere, they are stored elsewhere. So when there is that act of intercourse, the moment men have an orgasm, what happens is that in microseconds, the sperm is released from where it is stored, travels through these pipes, what I'm talking about here, blocked tubes, and mixes with seminal fluid through the prostate and comes out as an ejaculate. But it so happens sometimes that these tubes can be blocked. So what comes out instead of sperm plus the seminal fluid is just the seminal fluid alone. But there are ways we have of diagnosing this and treating it. Genetic diseases, luckily in this part of the world, we see very, very, very few. So far, I haven't seen anything about cystic fibrosis. Cystic fibrosis is basically a disease whereby any organ which has a hole is filled with mucus, and you cannot, for example, here we're talking about male fertility, so the tubes are actually blocked by mucus, so the sperm cannot be able to pass through. Hormonal imbalance, yes, we do see that quite a bit. Erectile dysfunction, we don't talk about it, but it is a problem. Erectile dysfunction is a place whereby a man cannot be able to rise up to the occasion, or if he does have an erection, then that erection is not firm enough, or it just, when it's time to have intercourse, it disappears. Usually a problem in older age or in gentlemen who have other medical problems, but again, it is also affecting young men in the 20s, unfortunately. Which young men are we talking about? I was talking with one of the senior urologists in this town. He told me he has seen a phenomenon whereby seeing young men who are in the 20s, 27, 28, 25, come to him with erectile dysfunction. A tragedy. Why? How anyone want to maintains? I can see my senior brothers here have no idea what maintains are, but that is okay. Young men who go to, let me put it this way, service, quote unquote, older women. And they are taken, their job is just to service, basically sexually service these older women. And they do it once, they do it twice, the third time they may not be able to do it. So what do? They take a blue pill. So the blue pill is used once, it's used twice. After some time, they want to take a little bit more, and then later on, it doesn't work. So you're 28, 29, and you know what happens to that sugar mommy? She gets another 10, and life continues. You have a girlfriend, or you are already going to be married, and you cannot rise up to the occasion at 28 or 29. A tragedy. We have issues with ejaculation, because without ejaculation, there is no way you're going to impregnate this woman naturally. So sometimes because of let me say, these gentlemen, some of the gentlemen are born with the piping not the way it is supposed to be. So instead of the ejaculate coming out, it goes back into the bladder, what we call retrograde ejaculation. It's not something that they have done, it's just basically the way they have been born. We have ways of going around that. There is also unejaculation, meaning they just don't have that ability to ejaculate, to bring sperm out. Other issues, there are so many other causes of infertility in men. For medications, I mentioned that. Radiotherapy, mentioned that. Surgery, for example, hernia repair. Undescended testicles. In hernia repair, we have what we call inguinal hernia, just on the side here, where naturally different organs, have to develop, especially when the young man, when a boy is in the mother's womb. the testicles, go down and go into the scrotum. Sometimes that place can swell, and if it swells, then they go in and do surgery. And unfortunately, sometimes if the surgery is not done well, some of the pipes can actually be nipped, or they can be, they can be tied, and that becomes a problem. Undescended testicles. These ones, unfortunately, for those ones who have children or who will have children, boys, we have to make sure when you are washing them in the evening or whatever it is, check in the testicles to see whether you can feel that a small hard thing in the testicles, because that is the time we can actually diagnose these and take them for treatment. Otherwise, later on, we find that these young men grow up, they get married, of course, everything is there, they have normal intercourse, but when whatever comes out has no sperm. So when we check, we find everything is okay. When we send them for a scan, we find that in the testicles, in the scrotum, the testicles are not there. They are somewhere in the abdomen. So we have to look for them, all right? And then do something about that. Testicular cancer, I think that is straightforward. There was a time somewhere in, we don't have Central Province these days, whereby the women were so angry. The men would come home drunk and they would not be able to do what they are supposed to do. What they said, do. If I can't use it, let nobody else use it. So they would actually remove trauma. So you remove everything, the testicles plus the penis. So that man becomes completely, I don't know what you call him, but that was a problem. Quickly about infertility in women. Age is a big problem. And what age are we talking about here? We're talking about 35 years and above. Why? Because ladies are born with a set number of eggs, and this number decreases with the time. So once you get to 35, that number starts decreasing. So ladies who are 35 and above, and you haven't got Mr. Right, I don't know what to tell you. But please take care. Hormonal imbalance, we have a lot of issues here with premature ovarian failure, whereby I got a young lady who was 18, and when we did a hormone profile, it looked like a lady who was actually in menopause. Premature ovarian failure. Sexually transmitted infections. Here we're talking about gonorrhea, we're talking about chlamydia trachomatis, and so on. What do? They actually go and lead to blockage of tubes. Because remember, as the men have tubes where the sperm passes through, ladies have tubes where the egg passes through, and where the sperm passes through to meet with the egg, and then afterwards, the baby which has been formed, the embryo, has to pass through there to go into the womb where it attaches and a pregnancy begins. Talked about adhesions there. When we remove the tubes because of surgery, because of ectopic pregnancy, when a baby implants where it is not actually supposed to be. And we have to remove these tubes because most of the time there is a lot of bleeding and we have to rescue the patient, so we remove the tubes. It leads to infertility. Post-abortion related complications. The Seventh-day Adventist Church, do we talk about abortion? Do we talk about abortion? Is it because it doesn't happen? Does it happen in church? It does happen in church. But do we talk about it? No. Why? Stigma. We all have sinned and fallen short of what? Of the glory of God. And unfortunately we have this here. Unajua alitoa mimba. Unajua yule alitoa mimba. Now, let me tell you a bit about statistics. This is a completely different topic altogether, but just to give you an idea about what is happening in this country. Yearly, this is according to World Health Organization, we lose 3,000 women because of complications of abortions. 3,000 women yearly. And these are the ones who die. Out of these ones who die, generally about 496,000, almost 500,000 illegal abortions are procured in this country. Almost 500,000. And out of this, about 20 or 30,000 complicate out of which 3,000 die. Is that a small number? Does it happen in church? But we don't talk about it. I think it is time we actually came up. We are not an island. These problems that are out there are also here. The only thing is that sisi tunasemaga happy Sabbath, tunaenda nyumbani. Not a good thing. Now, complications of abortion we have. The other time, there's a time I was on call in KNH, and in one ward, there's a ward we call 1D. There were 4 or 5 women in one row, 4 or 5 beds. All those ladies were married. All of them had children, 2, 3, 4 children. All of them had procured an illegal abortion, and all of them had complicated. And that was in one day. And these are the ones who came to hospital. And there are many others who didn't come to hospital or who were in other hospitals. It is a serious problem. So complications of abortions, what happens is that sometimes you see these women who come with their uteruses punctured, sometimes with their intestines, dragging out. Sometimes they come because of sepsis. We have to get rid of their wombs, and at a very early age, etc., etc., etc. The uterus, that is where the baby grows. Sometimes that uterus has issues. It may have what we call fibroids, which are growths. And by the way, if you're an African lady, 40 to 60% of women of African origin, it doesn't matter where you are, whether you're in Cuba, the US, Nairobi, whatever it is, if you're a woman of African origin, you have 40 to 60% chance of having fibroids. All right? Not really a big problem, but it is a problem which we have to think about. Okay? These fibroids can be inside the womb, they can be outside the womb, they can be inside where the baby is supposed to grow, and so on. It can be a problem which causes infertility. We have a growth called an endometrial polyp, where that lining where the baby attaches grows a little bit thicker than what it is supposed to be. Sometimes that womb, when during its formation, does not completely form, so we have a division inside the womb, what you call a septum or a septile. And sometimes, about 0.1% to 0.5%, a woman may not have a womb completely, all right? We have what is called endometriosis. 15% of the women who come because of infertility actually have a problem with endometriosis. Polycystic ovarian syndrome. This one affects about 10% of all young women who are also trying to have a baby. Medical problems similar to the ones that I mentioned about in men, diabetes, hypertension. Sometimes the thyroid has a problem. We need to check this. Lifestyle. What do we eat? What do we drink? Remember we talked about we have to be well endowed. But then unfortunately out there is this. People say that ladies especially say this, that whatever men can do, women can do what? Women can do better. And unfortunately, it has gone to a place whereby you find women are drinking more than men, they are smoking more than men, and they're doing all manner of things because we can do better. I had a patient who came to see me, and as one of the questions that I asked is, do you smoke? No, I don't smoke. Do you drink? He said, yes, I drink. I said, okay, well, what do you drink? He said, I drink a bottle. I said, okay, a bottle of what? In my mind, I was thinking it's a bottle of wine, maybe. But even a bottle of wine, for goodness sake, that's a lot of alcohol. She says, I drink a bottle of Johnny Walker. A liter of Johnny Walker. And then I asked, what period? People who drink, they say a liter of Johnny Walker, it can be a month, it can be, whatever. He said, no, I drink it on Saturday nights. I said, what? Saturday night, a liter of Johnny Walker, and you want to get pregnant? Really? I said, you have to stop. You have to stop immediately, otherwise I fear for that liver. She never came back. Maybe she loved her bottle better. There can be a combination of factors, there can be endometriosis with issues with fibroids and so on. It can also be lack of sexual intercourse. One time we had a clinic in Mombasa, and about 30 or 40% of the ladies that we talked about had intercourse 2 weeks in a year. Why? Because the men used to work out there in the Middle East, in Dubai, Saudi Arabia, whatever, and they would come home only for a month or so in a year. And they were trying to get a baby. So how do you get a baby when your husband is out there, and he only comes home for a short period of time, and God forbid he comes home when you're having your periods? So obviously you won't be having this until the period is over, and when your periods are over, he has maybe only about a week, and he's off again. So that is also a problem. Talked about what are some of the consequences of infertility. Stigma. You don't have a baby, you are not a proper woman, or you are not a full woman, or you are not a full man, as it were. Isolation, being rejected, a low self-esteem, okay, and then psychological stress. We remember there's a story about a lady somewhere in Machakos who had her hands chopped off. We don't remember that? I think that was about 4 years ago. By the way, she was an Adventist. Yes. And guess what happened? She actually got pregnant. The problem was with the man. The problem. Then we say Bele iko sawa. Unfortunately. So there we go. Breakdown of relationships. There's violence, there's divorce. I've been put in some WhatsApp groups of ladies who can't get pregnant, or who have issues with getting pregnant. And some of the stories they posted there are just out of this world. You don't think a human being can do that, but they do it. Oh, nimeangalia leo, I saw whatever. And how do these ladies get to their husband's phone? I have no idea. And then they take pictures and send on the WhatsApp page. Today, this is what I have seen. They say, and then there's a communication. The husband talking with Ampango Akando. I have booked a room in this hotel, room number 415. Ufungue ndo uchukue tukutane huko. He said, now what should I do? Woye tafadhali wewe wachana tuenda uombe. These are now her lady friends telling her, go and pray. Woye, just sit there and pray, God will help you, and so on. Another one says, my husband brought home another woman to our bedroom, and they're actually doing it now. What should I do? On WhatsApp. Now I actually don't want to read them, but I've been put there because I'm supposed to be helping them. So this brings there are a lot of couples out there who are hurting, and even in the church they're also hurting. Polygamy, which has been normalized in Kenya, it's part of the thing. If you can't have a baby, then let's get somebody else. And then there are these names that we give to these ladies who cannot have babies. In Luo they call them Luel. Is it Luel? Luel. In Swahili tunaita tasa, si ndio? Wakisi wako hapo? Ama hakuna Wakisi? Wakisi are good people. They don't name these people. They don't call them anything. Ititema. Mwomba. There you go. And so on and so forth. We give them labels and we stick them. And every time we actually identify them as Omom, Luel, Tasa, etc. Wewe ni mwanamke, kwenda huko tasa wewe utaniambia nini, and so on. It becomes a burden. Some people think that infertility is a burden to the family. Stealing of children. Remember there was a gentleman who was called Bishop there? You don't remember? Or we remember? Miracle children. 56-year-old. Sijui nini ati amepata mimba. When he was examining, he said this woman has never delivered. But there it is. Socially accepted promiscuity. In the Mar community, if a man doesn't have children, men in his age group are allowed to have intercourse with his wife, and any children who come out of that relationship are actually children of that gentleman. In some societies, there is a question of women marrying other women. An older woman marrying, quote in quotes, a younger woman, who is allowed to have intercourse with whoever it is, but any children who come out of that relationship are actually the children of this older woman. I think the Kikuyu community, the Kalenjin, I think, and I think other societies as well. It was a way of sort of mitigating infertility. Inheritance becomes a problem. God forbid if you pass away and you don't have a child, that is when you know who your real brothers are. Wakisi. Haki. Nasi wakisi peke, by the way. Huyo alikuwa ni ndugu yetu. That time the wife is not even known, she's chased away like a dog, and everything that belongs to the brother belongs to us now. Huyo ni ndugu yetu. It's as if the woman that he shared his life with has no role at all. Can we do anything to improve the chances of infertility? Yes, we can, by eating healthy. We'll be talking about what we eat. Very, very important. We are what we eat. Exercise is very important. It releases natural endorphins, which reduce stress. And the reduction of stress makes you feel happier. It also has a knock-on effect in the bedroom issues as well. For those ones who drink, we actually advise them to stop drinking or reduce alcohol intakes. Quit smoking. And here, keep the crown jewels cool. Crown jewels, here we're talking about the testicles. Why? Any of us has a laptop? We have laptops, isn't it? Please, gentlemen, if you're thinking of having a baby, don't use the laptops on your laps, as it were, because of the heat which comes from the laptop actually increases the heat in the scrotum, and this will affect the production of sperm. So use the laptop, put it somewhere, but not near your laps. Obviously, for ladies who are trying to have a baby, it's important to supplement, give them folic acid as they're trying to get pregnant. How do we diagnose this infertility? Number one, we need good medical history, medical surgical history. For the men, we need them to go and give us a sample, which, as I said, it is done through masturbation. And we look at that sample, the parameters that we look at. We look at the volume, we look at the pH, we look at to see whether there's any agglutination. We look at the number of sperms in a milliliter and the number of sperms in the total volume. And if there are any other issues, we can actually send this gentleman for extra tests, a scan, a hormone test, sometimes even a urologist review is important. For the ladies, we need to do a blood test, a hormone test to look at their hormone levels. We do a scan to look at their ovaries, and we check whether their tubes are okay, because if she's trying to have a baby and if the tubes are blocked, then naturally she may not have a baby in that way. There are other methods of checking by what we call HSG, by taking her to theater, doing what is called a laparoscopy, and dye studies, and so on. So what are some of the myths that we have about infertility? That it is a female problem. No, it is not true. It is not true. About 40% of the reasons of infertility, they are on us, men. So infertility does affect men and women as well. Here I've mentioned about the LGBTQ community because they also have issues. Obviously, if there are two ladies, there's no way they're going to have a baby naturally. They have to have sperm from somewhere, right? I don't even want to mention about men, but yeah, it is a reality. It is there. The other day, my colleague, a lawyer, sent me a message and told me, Dr. I'm sending you a colleague of mine who wants to have twin boys, but does not want to have anything to do with a woman. Why? Because in case he got married, and this woman in the future can decide to take away the children. So here is a gentleman who wants to have babies alone. It used to be a female problem that is only females who want to have children alone, but men are actually joining the fray. They want to have children and they want to have them on their own. They don't know what they're getting into. They have no idea. But it's our turn. If a man can ejaculate, his fertility is fine. Wrong again. It is not true because he can ejaculate, but that ejaculate has only seminal fluid and it does not have sperm. So that is also not true. The other myth is that infertility is rare. It is not rare. We talked about 20%, about 5 million Kenyans who have an issue with getting pregnant or having a baby for that matter. So it is not as rare as people think. The only thing is that it is stigma, it is hidden, people don't want to talk about it. Young men and women can't be infertile. Again, it's a myth because we see ladies who are 25, ladies who are, who are less than 30 having issues with infertility. One because of either they have endometriosis, they have polycystic ovarian syndrome, they have blocked tubes, etc., etc. Or they even don't have a man, for that matter, to have a baby with. So it is not true that young men and young women can't be infertile. We see young men actually 20-something years and they are not producing sperm, for that matter. Well, I think let me tell you a story. Met a young man. How many are 30? 32, 33? How many? Men. Wangapi? Oh, I can see we are well represented. I used to have a clinic in Nairobi West Hospital, so this day on Mondays. So this day I was a bit late because I was elsewhere, and when I got there was this young man who was very agitated, 32, maybe 33. Doctor, where have you been? We've been waiting for you for so long. I said, relax. I'm sorry I'm late because I was dealing with other issues, but I'm here. So he gives me his story, I ask questions, I take down notes. And when it came to, do you have children? He told me yes. Have you been married? He said yes. This was his second marriage. I said, okay. So in my mind I was a bit intrigued. Your wife, do you have children? Yes, we have children. How many? With the second wife, we had 4 children. And now he's married, or he was married to another lady who was pregnant 6 months. So 4 children with the first wife. The second wife is pregnant 6 months, and she also had a child with somebody else. So technically, he has how many children? 6 children, but let's say 5, because it came with another one. So I said, okay, something doesn't add up, doesn't make sense. So if you have 5 children, why are you coming to me? Anyway, so he gives me his palm test. I look at it and I scratch my head because it doesn't make sense. There is 0 sperm. I said, well, sometimes it can happen. So I asked him, but if you have 5 children, why did you go to do a sperm test? He tells me, 5 whatever number years ago, I was in a relationship, and after some time, this lady told me that I was infertile. Ladies, you see what you do to men. So that thing stuck in his mind, and he went and did a sperm test on his own volition. Came back that he had 0 sperm. So I said, well, possibly this could be a problem with the lab. Let's do another independent test. Did another independent test a week later, 0. I said, well, could be some issues. Let's do a hormone test and let's do a scan. Did a hormone test, did a scan. The scan said that the testicles were atrophic, meaning they're tiny than they're supposed to be. The hormone test, the levels were very high, essentially meaning that there was no production of sperm. So I explained to him and I told him, according to this, it seems as if there's no production of sperm. And usually when the hormone levels are elevated like this, it means that most probably you have never produced sperm. How many children does he have? So he said, is there something that can be done? I said, well, you can. I can send you to a urologist who can go and have a look. So I sent him to my colleague, a urologist. He went and did what is called a biopsy, testicular biopsy. Did a testicular biopsy, and they look at it under a microscope, and it's what is called primary arrest. So, just to give you an idea, it's like a baby. When a baby is born, it goes to nursery school, primary school, secondary school, university, mature person, kwenda huko kafanya kazi. So it's the same process of sperm development. It starts from that, whatever, step by step, until it's mature. The cycle takes about 2.5 to 3 months before the mature sperm. So essentially what he was telling, what the histologist told us, the pathologist, is that This sperm stopped growing when it was in nursery school. So there was no production of sperm. He has 5 children. So he asked me, Daktari, well, whose are these children? Aki ladies, what you do sometimes to men. Anyway, I told him, I don't know who's there. He said, so what you can do? I said, I had to wriggle out of this situation. I said, you know, in life, there are 2 types of fathers. There is a biological father, meaning you are the one who gave the sperm and everything. And then there is a social father, meaning that you are the one who has taken care of these children. You have taken them to school, you know, buying food for them, taking them out, you know, whatever. And it is always nice if it is you are a biological and a social father. But in this case, you are a social father. He said, oh, okay. But I still want to have a child. I said, but you can't. I'm sorry. With these results, I'm sorry. You can't. Even though ejaculation was not a problem. I suggested that he sees a counselor. He said he was going to come back. He never came back to me. And there are other stories as well of what happens out there. If I sat here and told you all the stories that I hear in my office, young men can be infertile and they are infertile because of different reasons. Okay? You don't need to worry about your age. You need to worry about your age, especially ladies. Please worry about your age. There's always IVF. In IVF, you know, we can take these eggs and, you know, create a baby or embryos in the lab and then transfer that into the womb. Yes, please remember, age is a problem. Okay? Gentlemen, yes, we also do need to worry about our age, but our age starts becoming a factor in the late 50s, 50 something, because then, just as in women, where the quality of the eggs starts becoming poorer, the quality of the sperm also starts getting poorer in men at around that age. It doesn't mean that it doesn't get poorer earlier on, but when we look at just age as a factor, it affects us a little bit later on. That is why in men, God created us differently, in that we continue creating sperm even when we are 70. That is why at 70, ukipata mzee who can be able to rise up to the occasion, gets a young lady, he can actually impregnate her 5 minutes. So, if you already have a kid, you don't need to worry about fertility. You need to worry about secondary infertility because it can affect you. If you never give up, you will eventually get pregnant. Not true. Because you continue doing the same thing expecting different results. Not true. If your tubes are blocked, you'll continue having that intercourse even 5 times a week. Even 5 times a day, you will still not get pregnant. So, you know, yes, it reaches a place whereby you need actually to go and look for assistance and for help. Herbs and supplements are harmless ways to boost fertility. Not true, because we don't know what is in those herbs. We don't know what concentration is there. We don't know the active ingredient, and we don't know the mechanism of action. So, even when your auntie tells you, enda ukunywe glass moja kila siku, ama tu ukienda kabla ya kulala, take one cup before you lay. After two weeks utakuwa sawa, utapata mimba. It's not true as well. It reaches a place where you actually need help. Using some medications like Clomid can help anyone get pregnant faster. Not true, because if you have issues with your tubes, even Clomid will not help you, or even other medications will not help you. Thank you very much. If you have any 1 or 2 questions, because I've been told I have 5 minutes. All right? Do you have any questions? Yes, sir. Oh, there are 2. 3 even. Okay, please go ahead. Do you mind standing up so that they can hear you, please? The phone is not very clear. Some people have been been trying to do some research on that, but we don't have clear indication whether the electromagnetic field can actually affect testicular function. That one we are not very clear about it as yet. Yes. Second question, I think it was here. Yes.
Yeah, you try to avoid the more sensitive aspect of the infertility, how to solve it. You didn't especially the issue come around. And most hospitals now try to solve using those methods. And because of our beliefs as educators, how we look at this.
Okay.
Especially when one is, especially when the man is cruel and there's a small problem with the lady or the other way. Yeah, because the type of those are sensitive, but how do you...
Some methods of treatment. Okay. Yes. I'll take all the questions and then answer them one by one. Family planning, Depo-Provera. So the organizers, can you give me 5 minutes? I answer these questions because you told me I have 5 minutes. I don't know what the organizers are here. They are not. They are not here. Yes, the third question, please.
Yeah, so is there a relationship between bicycle riding and boda riding and infertility in men?
Okay, thank you very much. Bicycle riding, boda and infertility. Do you mind if I do that and then we come to you? So let's start with US. Boda riding, bicycle riding, and infertility. Now, I can also connect that with some of the professions that we do. People who work in places where the temperature is high, for example, in glassworks, in bakeries, and so on. Drivers, long-distance drivers, who have to sit for 8 hours, 10 hours, and so on. It has been noted that in some of these professions, again, the boda, you are seated, heat from the engine. Yes, these ones do have an effect in the production and the quality of sperm. The issue about riding a bicycle, that one has not been very clearly sorted out, but there are also other things, because when you are sitting there and you are riding, you are actually massaging the scrotum without you knowing. It's not very clear whether that directly has an effect on infertility. But heat from the engine of boda and the long distance drivers and in factories where there is high temperatures, that one has been noted to have an effect. The issue of contraceptives, again, that is a whole topic which we can sit and talk about. Again, we as a church, we're not talking about contraception. Tunanyamaza, tunasemaga happy Sabbath, kila mtu aende nyumbani, which is also not a good thing, because we need to talk about this, because my feeling is that the church should be the center of actually where our young ladies and our young men should actually get this information from. Not from YouTube, not from the peers, not I don't know from where. They should actually get this information from the church. Now, the issue of taking contraceptions and infertility, just very, very broadly. Now, the fact that we're taking contraception, it means we don't want to get pregnant. We either want to space those babies, or we don't want to get pregnant at all, or we are using the contraception, especially when it comes to hormonal contraception, for other issues like heavy bleeding, heavy menstrual bleeding. We have endometriosis. We also use contraception as well. The issue of Depo-Provera, when it comes to Depo-Provera, you find a lady has used it twice or 3 times, and then first of all, what happens is that the cycles don't come back as quickly as we would want them to come back, and then later on others come and say, it is because of Depo-Provera that I'm not getting pregnant. I don't think there is a cause effect that I use Depo-Provera That is why I'm infertile. I'm not getting pregnant. The issue of the cycle coming back, that one can be sorted out. But is Depo-Provera the reason of infertility? I don't think so. So we should actually go back and now do a proper analysis whether there is something that has changed since the last time that she got pregnant. Is the husband okay? Is she okay herself? Are the tubes okay? etc. So. But Depo-Provera equals infertility. I don't think we can put that together that way. So. Than the Depo. First of all, even just the use of contraception, we should not say don't use this or don't use that. Let's talk to the patients and give them the options and say, look, we have tablets, we have a combined oral contraceptive pills, we have the mini pill, we have this, and we have all this. Out of all this, which one do you think is okay for you? That is what we should be doing, but not condescending, telling the patient, I think you should use Depo-Provera or you should use an implant. No, that is not our role. Our role is to give the information to the patient, because what I do to patients is I tell them, if it were my wife, this is what I would do. So, when you do that, it will be a completely different story. I do that with my registrars in the ward round. I ask them, what would you do if this was your wife? And then they say, if it was my wife, hey, now that is the catch. So let us put your wife or somebody very close to you in the patient's shoes. When you do that, it will be very clear what you want to do. So you won't have two things. This is for my wife and this is for patients. This is best practice. Let me just finish.
So technically this session should have ended 10 minutes ago, but the attention on your faces seems like you wanted to proceed till midnight. So here's the thing. You can proceed till whichever time, but at 6 you're meeting back for supper. Then we meet at MC3 on 2nd floor for a round fire session. So you could proceed till when you decide to end it. Thank you.
You've been given the green light. So coming back to that issue, please don't tell patients that you can't use this or you can't use this. Give the patient the information, let the patient decide. And as I said, that is my principle. Every time a patient comes to me and I tell the patient, this is what I think the problem is, and this is what I think, Daktari, what would you do? I say, let me put it another way. If it was my wife who has a similar problem like yours, what would I do for my wife? Why? Because I want the best for my wife. And you are somebody else's wife, so I also want the best for you because you're somebody else's wife. If it were my wife, this is what I would do. I would take my wife to theater. Because I will take my wife to theater, that is why I'm taking you to theater. I will not take my wife to theater, so I will also not take you to theater. But if you want to go to theater, I can send you to a friend of mine, Ambatakupeleka Theater. And when you do that, they say, Apana, I'll stick with you. So let's have one principle for everybody. When you do that, we won't go wrong. To your question about methods of treatment. Okay. Can you hear what he's asking, by the way?
Okay. We are in a situation.
Yeah, we are in a situation where the lady is having a problem with the eggs, but the man is okay. So there's your technology where you bring the sperm and the egg from the sister. So you say, no, I can't get the eggs, I'll get from my sister. Donation, do the fertilization externally, but then implant in the womb. There's a situation like that, but then maybe the lady cannot carry the pregnancy through, then you look for surrogate mother, and the external fertilization is done, and then implanted in the sister. Yes, there are situations like that. Maybe you may not be the right person to answer this question. A pastor would be, but just go ahead and answer. Maybe we could also react from this other end if there's someone who can do that. It's a tough one, but it will solve your problem. Some say that it's better than adoption. Why should I adopt somebody's child? If my sister can help me, I better adopt one. Is 80% done. Far much better.
So methods of treatments are many. Again, it depends on the cause of the problem. I didn't mention about it because of time. But now that we've been given a little bit of time, I'll go into the methods of treatment. Now, we have done the diagnosis and we have found that the lady has a problem. Let's say has blocked tubes. We cannot use the blocked tubes. Or sometimes even the tubes are blocked and they have fluid in them. So what do we do in such a case? If the tubes are just blocked and there is no fluid in them, we actually do IVF. What does IVF mean? We treat that patient. You saw that picture where Louis Brown and IVF 6 million. IVF, in vitro fertilization. It means that normally a woman produces 1 egg every month. But in IVF, we want this woman to produce as many eggs as possible. So we take her through a treatment process called stimulation, which usually starts on day 2 or day 3 of her period. We do a blood test and we do a scan. We see everything is okay. We give her medications, injections every day for about between 10 and 14 days. As we are doing this, we also do monitoring to see whether those eggs are growing well. Remember, we want her to grow as many eggs as possible. As I mentioned, age is a factor, so the younger they are, the more eggs they'll produce. The older they are, the fewer eggs they'll produce. So once they are ready, we take them to theatre. There is no way we are cutting when you take them to theatre. We actually do the harvesting transvaginally, all right? We use a very long needle, about that long. Obviously, the patients don't see this because they are asleep. So we go and puncture what you call the follicle. A follicle is what carries an egg. We puncture the follicles and we aspirate whatever is there, the fluid plus the egg, which we can't see. We give this to a scientist in the lab called an embryologist. So once we've collected these eggs, let's say we collected 20 eggs, the husband or the gentleman gives us a semen sample, and in that semen sample, by the way, most of it is rubbish. And I use that very liberally. It's rubbish. But actually, if you realize that in a sperm sample, let's say 100 million sperms, we only need 5% to be okay. All right? So imagine 95 million are. So we clean that sample, we remove whatever is not okay, we remain with the best sample, as it were. So we take 1 sperm and inject it into each egg. All right? 1 sperm into each egg, what we call ICSI, intracytoplasmic sperm injection. So basically what we are doing is what happens in the tube, but now we are doing it in the lab. So once we have done that, we put this in an incubator, 37.2, 37.3 degrees constant. A bit of carbon dioxide, a bit of oxygen, and we leave them there. All right? So we have actually done fertilization. So what we want is for them to start growing and dividing. When the psalmist says that we are beautifully and wonderfully made, it is exactly that. Imagine we have come, all of us, we have come from something which you cannot see. Because you can't see a sperm with your own eye. And the egg, you also can't see it with your own eyes. But you can see it under a microscope. And in that egg and in that sperm, it has all the characteristics of who we are today. So it grows the first day, they divide into 2. The second day, we see 4 cells. The third day, we can see 8 cells or 10 cells. Then we are ready for a transfer. We can either do a transfer on day 3, or we can let them grow a little bit. It goes to what is called a blastocyst, which is day 5. All right? So we take it, and in the meantime, remember when we remove the eggs, we give this lady some medications as well to support what we call the lining of the womb, such that when we do a transfer, we're increasing the chances of this baby actually implanting and the pregnancy taking place. So that is IVF. Use it generically, IVF. The question you are asking is if this lady, the eggs are not many, right? And the man is okay. So the lady is 40, for example, or even 45. To say after 50, can she have children? Yes, she can. How do we do it? In this case, because remember, the older we are, the poorer the quality, the poorer the number of eggs, the lower the number of eggs. Then we can have a substitute. We can have a donor who can actually, where we can get eggs from, we fertilize them. And as we are fertilizing them, we are preparing this lady who is 40 or who is 45 or who is 50. We are creating that environment in the womb such that it is good enough for the embryos to go in and to implant. So, and we can actually do that. So your question you are asking is what? Is whether this is okay or it is not okay. I think we need a lady to tell us that whether it is okay or not. But before we go there, two things that we need to think about. That for this donor, there are two ways of getting a donor. You can get her own sister, for example, who is younger, to produce eggs for her. We can get her cousin. We can get a friend, to get eggs. Let's not go into friend because that's too far. We have sister or a cousin, all right? A very good thing to do, by the way. I've had several patients who have done that, but are always with a word of caution. If your sister is going, or even for the men, by the way, even men will also have issues. If your sister is going to produce eggs for you, please sign an agreement, sign a contract. Kwamba, her responsibility starts and ends with donating of eggs, and that's it. She will not later on come and say, nilikupatia mayai, by the way. Na katoto, by the way, it happens. Men is also the same thing. There's a couple whom we had, and the elder gentleman could not produce sperm, so he brought his younger brother to produce sperm for him. Fair enough. It's exactly what you're saying. It's in the family. See them. The family, the young man gave sperm, created embryos, tukamwekea mama, mimba ikashika, delivered a baby boy. See, everybody's happy. Now the young man, the brother of this gentleman, would go and drink a little bit of alcohol and come to visit his elder brother in the evening. Comes, is a bit drunk, they welcome him, he's a brother, sit, supper. Now we are going to sleep. And the young man says, today is my turn. And the elder brother asks, your turn to do what? It's my turn to sleep with your wife. He said, what? I mean, why are you shocked? In any case, I'm the one who gave sperm, so what is the difference? And for ladies, if this your sister gives you those eggs, siku ile mtakosana ndio utajua hujui. Akasema, wewe jinga, unaturingia na katoto. Uliza watu wa mayai yalitoka wapi? Muulize leo. Ask her, let her tell us here. Mayai yalitoka wapi? Aseme leo hapa. And it was a secret, by the way. It was a secret. We are doing this in the family. Nobody. Leo watu wajue. And then people will ask, we African. Aseme, je, ati mayai ya Mary ulichukua namna gani? Nyinyi ndio mmekuwa warogi hapa, nyinyi ndio mnaua watu. So it turns into something completely different. And then apart from that, it sometimes happens that life has a very interesting way of doing things. You may find that she donated eggs to this lady, and then she doesn't end up having babies. If she comes and says, by the way, these are my children, twende tufanye DNA. They will do DNA. And they will find actually this is a perfect match. The court will say, mpatie watoto. What are you going to do? What are you going to do? I had a case. Two sisters. Mr. and Mrs. A, the elder sister, have 3 children. Mr. and Mrs. B, the younger sister, no children. Tried several years, tried IVF, didn't work. The families sat together, the A's and the B's. They said, you know what? Since Mrs. A is okay and has been having babies, why don't we use Mr. B's sperm and inject it into Mrs. A so that she can be able to carry a baby for Mr. and Mrs. B? They agreed. So they came to me, they said, we are a very happy couple and we are very close sisters. The sisters were very tight. We are very tight and whatever, we have agreed, the men are okay. Yeah, I said, it's fine, there's no problem. So I prepared Mrs. A, she was ready. When she was ready, Mr. B gave us a sample. I did an IUI, that is intrauterine insemination, and we waited for 2 weeks. Mrs. A does a pregnancy test after 2 weeks. It's negative. So it didn't work. A week after, Mrs. A does another pregnancy test. She's positive. And they came, both of them. Daktari, what is happening? I said, I have no idea. See, we tested, it was negative. Now you've tested again. Actually, it was 6 days after the first test. 6 days after, it's positive. So Mrs. B is happy that her elder sister is pregnant, and she's sure that that is her baby. So what does she do? Mrs. B is very happy, takes care of her elder sister, comes with her for the antenatal care all throughout. When it's time to deliver, I deliver the baby. Mrs. B pays for hospital, pays for everything. But now you see, because I told them, you know what? Nobody can tell you whose baby this is. But once the baby has been born, we are going to do a DNA test. So we do a DNA test. And guess what? The baby is Mr. A's and Mrs. A. And you know what Mrs. B said? He said, no, in Kenya, my sister must have gone and must have talked to somebody in the lab, and they must have changed. I'm sure that is my baby. There was a fallout amongst the sisters. They are enemies, they don't see eye to eye. Be careful about that when it comes to donation. What I advise these couples, if you want to do donation, talk to your sister, it's okay. By the way, I have couples who have actually used their sister's donation and they are happy, but I told them, sign a contract. Such that it is very clear what you are doing, what is expected of you. So. Now, what I advise them is that if you do that, please sign a contract. The other option is to use an anonymous donor, whereby the anonymous donor does not know you, you will not know her. Her job is just to get eggs, and we fertilize them with your husband's sperm. Tukuwekee wewe ubebe mtoto, siri is between you and your husband. Mukitaka kusema huko nje ati mayai tulitoa kwa sijui nani, hiyo ni shauri yenu. But obviously you can't do that. Other cases, there are quite a number of cases. A gentleman, gentlemen, we have an issue. Anyway, this couple came to see me. She was 40, 42, 43. The lady was 43, 44, basically the same age. They want to have a baby. I said, with your ages, it's going to be a challenge, especially for the lady. But for the man, it should not be a problem. We can use a donor egg for the lady, and we use your sperm. They were okay with that. So we got a donor for the lady, went through the whole process, we get hot eggs. But you see, before we do the fertilization, we need to know what we are going to deal with on the man's side. So we told him, give us a sample so that we know the quality. He said he'll come. He never came, never gave a sample. On the day that we collected the eggs, we called the gentleman, come and give us a sample. He won't come. He didn't come. Called him again. After collection of eggs, we have about 3 hours. Either we fertilize them or we freeze them. The guy didn't come. So we called the lady. I called the lady. I told her, you know what? We are having a challenge. Your husband has not come. You need to make a decision. He said, I've been having a challenge with my husband, but do you have donor sperm? We said, yes, we do. Give me an hour. An hour. Within an hour, she was there. She came and looked at the profiles that we have. She says, this one. She signed the papers. We went to the tank. We got the sample. We created embryos. After 3 days, I did a transfer, 3 of them. After 2 weeks, pregnancy test is positive. She came later on, she was carrying twins. I followed up the pregnancy. She went and delivered a baby boy and a baby girl. She later on came and told me that, that I had a challenge with my husband, because any time we discussed this issue, he would go and hide in the bedroom, literally. One time he decided to run away from home and went to his mother in the village. And this lady followed him to the village. And when she reached the village, she went and talked to the father-in-law and said, we are having a challenge and this is a problem. When the husband had her speaking to his father, the guy went to hide by the river. A man of 43. He was afraid. And we are afraid. We are afraid of, going and giving a sample and then upatikane wewe ndio una shida. But it is something which we need to embrace. The issue, I think the other issue you are asking whether it is the right thing to do. I'm not very sure whether I'm the right person to answer that question. But what I can tell you is this, we are pastors are here. Yes, but what I can tell you is this. Once a woman has decided to have a baby, once a woman has decided to have a baby, she will have that baby, whether with you or with somebody else. Now, check. She will have that baby. Na itaingizwa box. Ikiwa utaingizwa box, hautajua uliingizwa box sangapi. But that baby will be there. I don't know whether pastors, you kama mnaweza kutusaidia. Is it the right thing using donor eggs, donor sperm? What do we think?
Just a statement. All the church has official statements on all these issues. And I think I will encourage. I thought I'm not enough. I'm saying the church, the health, general conference, health ministries, has official statements on all these issues we are discussing. Whether it is clowning, whether it is assisted reproduction, family planning, abortion, all that is listed in the website. So people can go to adventisthealthministries.org, then they can read the statements. And I even support you with biblical evidences so they can read. Thank you.
Do you have any other comment to that? The church has official statement. Any other comment? Pastor amewanyamazisha. Yeah. Do you have any other question? Yes.
I am 45 years and my AMH result came out 0.01. Is there any hope of conceiving?
The AMH is 0.01 and she's 45. Is there any hope of conception? In medicine, we never say never. I will not tell you that we never conceive. Because I have seen things happen which technically should not happen. I had a young lady who was 36 or 37. When she came to see me, it was because of menopausal-like symptoms. Hot flashes, palpitations, couldn't sleep, whatever, and so on. So I thought maybe, something is starting to happen. When I did her blood test, amongst other things, I did her AMH. It was actually 0.01 at 35. So I told her, with this AMH, it's going to be a challenge to get pregnant. But she didn't want to have a baby at that time. Her problem was basically those menopausal-like symptoms. So I said, let us get some medications which will sort of alleviate these symptoms. We actually even started the process because those medications are not very many around. So we actually wanted to buy them through Nairobi Hospital. So I wrote a prescription and we started the process of importing the medication. She calls me after 3-4 months and said, Daktari, you know what? I'm heavily pregnant. I said, hallelujah. Cynthia, what else can you do? Be happy for her. She delivered a bouncing baby boy, 3.5 kilos. AMH of 0.01, who came with menopausal-like symptoms. She delivered, everything was fine. and then she wanted to have another baby. The same symptoms she came with had actually come back. When we checked her AMH, it was even lower than now 0.01. So it is possible, but the chances are very small. So I cannot tell you can never get pregnant. If somebody tells you that, that is not right. So it is possible, even though the chances are very, very, very slim. Assuming everything else is okay, tubes are okay, whatever. There's a hand at the back there. So I think you may need to come in front.
Thank you, Doc, for the wonderful presentation. I think for me, the question I have is more of offside. Now, what have you ever been in a situation whereby after the IVF, yes, after the formation of you have the egg and the sperm, and then fertilization has happened in the test tube, and then because of one reason or another, you had to discard. Has such a situation ever arisen, and how did you go about it?
So we have created embryos, and as per Constitution 2010, which you guys passed, is as per the Constitution, life begins at conception, meaning the moment the sperm hits the egg and there is fertilization, that is the moment life actually starts. So the question from my brother is, you have these embryos, and the couple says, you know what, get rid of them, so what do we do? Actually on Friday I got a message from one of my patients and said, I don't know what to do. My husband has filed a case for divorce. I'm sure we have some embryos remaining. Can you get rid of them? Or you get somebody, if there are any couples there, you can actually give them those embryos. If you need my signature, let me sign. So that is what you're asking, isn't it? A very difficult thing. Why? Because remember, that is life per se. I have no jurisdiction on those embryos. The people who have that jurisdiction are actually the parents. They are the ones to decide. Okay, we can take another case whereby, for example, I had another couple, we did IVF, we got I think 15 eggs, created embryos, transferred 3, all of them took, carried triplets, 2 boys and a girl. And they have 10 embryos remaining. And the lady said, I do not want any other baby. 3 at one go. So what do we do with these embryos? They decide what they want us to do with them. First of all, just for your own information, in this country we don't have a law governing what we are doing. ART, assisted reproduction technology, we don't have a law. So technically, anybody can do anything with those embryos. If you think I've committed a crime, I'll go and engage Orengo, we'll go to the High Court, that'll be fine. That's just by the way. Now, in some countries what they have done, for example in the UK, in the consent form for treatment of for IVF, when it gets to there are 3 options. Option number 1, discard the embryos. Option number 2, offer them for research. Option number 3, donate them to couples who may not be able to afford the process of ART. When it comes to discarding the embryos, they have to sign both of them, that we are in agreement. Then the embryologist, remember I mentioned about a scientist in the lab, will actually remove them from where we have frozen them. We freeze them at minus 196 degrees Celsius in liquid nitrogen. Remove them from there, put them in a small container of water, and they will die. You have to have the sickness. That is what happens in other countries. Give them up for research or to research. We haven't reached a place whereby we can actually do research on embryos yet, but in some other countries out there, yes, they do research. Mitochondria, they can remove mitochondria from this embryo and replace it with mitochondria from the other embryo in some specific diseases, for example. So that can be done. And then the third one is to give them up, donate them to couples as well who may not be able to afford ART. It becomes a bit sticky when it's an issue of divorce. Because now, how does a judge decide? There are 5 embryos. Do you take 3 and the other one takes 2? Do you divide them? How do you do it? It becomes a big challenge. So, in as much as this process, this new branch is actually the latest branch in medical science. It's only barely 40 years. In as much as it has helped quite a lot of couples, it has also raised a lot of ethical, a lot of moral questions, and so on. For instance, we had a couple in the UK. The gentleman was a medical doctor. The lady was a dentist. He had a problem. The gentleman had a problem with sperm. They came from the Turkish community. So when we told them, with these results, it's not a very good idea, guess what they did? They said the father was actually going to donate sperm. And the father donated sperm. And we created embryos. And we put them in the lady. And she delivered. Baby boy. Number 1. After 1 year, she came back. We had frozen embryos. Tukamwekea zingine. It took again. She delivered a baby boy. 2 boys. So, are these my boys? Or are these my brothers? Because you remember, it's my father who gave sperm. Yeah. So how do I look at them? Are they my children or are they my brothers? So if my father came and says, I have 3 boys here. Would he be wrong? He's not wrong. He has 3 boys. And I will say, I have 2 boys. Meanwhile, they're my brothers. It's not so easy. I had a lady who came to see me some time ago. Has 2 grown-up children, had 3 children, 2 boys and 1 girl, and the boys were twins, and I think, unfortunately, one of them passed away. So her intention was for the son to give a sample. We stimulate her, and the son gives a sample, so that we fertilize her eggs with her son's sperm, and then she carries the babies. What do you think? What do you think? So is that her son? So these are some of the dilemmas that we have. The ethical, sometimes moral. They are both grown-ups, by the way, and the law says, so long as they are grown-ups, you can do anything you want. Senor, you are grown-up. But then there are other things that go beyond just being a grown-up. We have issues of gender selection. I have 4 girls, 5 girls, 6 girls, or even I have 3 boys. One couple came and said, that house is so messy, it is so noisy, 3 boys, so much energy in that house, we need a girl to tone it down. So they start looking for a girl. Or that house has 7 girls, there's a lot of estrogen in the air, we need a boy to kuyamsha the dog. Is it okay for us to choose the gender of a baby? So what happens when we create these embryos and we have an excess of female embryos than male embryos? What do we do with them? Do we throw them away? What do we do with them? Because the owners don't want females, they want boys, for example. So these are some of the issues which come along, which have been coming. It's a good way, yes, but it has opened up Pandora's box, as it were, with a lot of questions, but interesting ones at the same time.